Well, good evening, everyone. My name is Ward Blackwell. I'm your Executive Director of the Pennsylvania Dental Association, and I would like to welcome you to our leadership webinar, Bridging the Info Gap. Appreciate everybody who's able to join us tonight, whether you are a leader in the audience through a link or you're live streaming on YouTube. Glad to have you. Hope you learn a lot about PDA tonight. We always start off with a little housekeeping of how we do this. If you're live streaming us, you just get to watch and listen. If you are a participant who has been invited and has the link, you will be in listen only mode, but you will be able to ask questions by typing them into the question box. If you look to the right of your screen, there should be a control panel with several lines on it. One of them will say questions. Click on the little triangle beside the word questions, opens up a box for you to type in. We will answer all questions at the end of the hour, and I will read them and direct them to the correct panelist. As always, we like to recognize the sponsorship that helps make this possible. It comes from the PDA Member Advantage Program, which is a program of Pennsylvania Enterprise Resource Corporation, a subsidiary of PDA. And it's all about getting good deals for our members on products and services you're likely to use anyway, to where you are getting an additional member benefit. If you have not checked out all those products, they are listed on the PDA website under membership, PDA Member Advantage. And with that, we'll move on to the introduction of tonight's panel. We've got a lot of information about PDA tonight, and a lot of our steadfast leaders are going to deliver it. You're going to be hearing from our president, Dr. Rich Grossman, our Governmental Relations Chair, Dr. Darlene Oleski, our PDA Leadership Academy Chair, Dr. Linda Himmelberger, co-chair, I should say, Dr. Jim Tauberg, who chaired the PDA Strategic Forecasting Committee, Dr. Jim Boyle, our ADA trustee, and someone who's usually participating but not visible, Michelle Berrones, the PDA Digital Media Manager, who always runs these webinars for us and does a fantastic job. But tonight, she's got some information that is kind of unique to her field, and we're going to start out with that, an introduction to a new feature of our PDA Go app. We now have a desktop version for those of you who sometimes want to get the same benefit from the app as you can get when on your phone, but get it while you're behind your computer. So Michelle, I'm going to turn it over to you and let you tell everybody about it.
Thank you. Hello, everyone. So just a few weeks ago, we introduced this desktop version of our mobile app, PDA Go. And can you believe that next month will mark 5 years since we launched the PDA Go app? 5 years. It's been a really valuable tool, and it's gotten us through a lot of challenging times. And it's enabled us to get information to members, to you all, quickly and conveniently. So the desktop version is similar to what you might see with other apps that you use. Let's say Facebook. That shows up on your mobile device, but you wait until you get home at night to log on your desktop, your laptop, whatever device you have, because you want to see it on a bigger screen. It's a little bit more comfortable. Same thing here. So when you're on your desktop computer or your laptop, simply go to your browser and you'll type padental.org/desktop. Can't get any easier than that. And when you do, you'll log in with the same credentials you use to log into the website and to log in on the app on your mobile device on your phone. When you do that, you'll see the screen that looks just like this with the news feed. That'll pop up first. You'll be able to see that. You'll be able to participate in forums. You'll be able to see the resources. You can look at events. You can register for them. You see a list of the app users and more. You can get a quote from Padeus. You can order your PDA perk supplies. And there's a handy link for online CE, just like there is in the app. But these are the features that are available on the desktop for you to interact with. So keep in mind that a few features will remain exclusive to the mobile app. And those are in-app messaging, and push notifications that go right to your home screen on your phone. So because we believe in the value that the app provides, we will continue to offer breaking news and special offers to our app users first. The graphic you see on the left shows you something that's on the home screen of the desktop. So it's just a reminder that if you don't have the app, you might want to get that so that you can see the things on the right-hand side that we're pushing out to members as exclusive material to thank you for being an app user and to let you know that you're going to get information first. In addition, we offer a great video tutorial playlist for all things website and app related. So in the same area where you would go to watch a replay of the leadership webinar, to watch a 411, many other things. If you type in padental.org/video, you'll be able to see all of the tutorials that we have. If you need downloading assistance, if you don't have the app yet, but you think, hey, I like the desktop, I think I want to see it on my mobile device so I can get those extra features, you can go here to the tutorial. It'll show you how to download on an Android device, how to download on an Apple device, and a lot more. You can even just learn about more value for the desktop. So we're very thankful that the PDA board agreed and supported this measure to bring more value to the app. So we're grateful for that. We're glad to be able to add this extra value to PDA Go. And we encourage you, if you have questions about anything, app related, desktop, anything, just contact us at the communications department. Back to you, Ward.
Awesome. Thank you very much, Michelle. Appreciate that. And your mention of the video library reminded me I neglected to tell everybody that tonight's webinar is being recorded, and all the recordings of these leadership webinars, the Front Street 411 videos, a lot of educational programs, mental health programs, and the tutorials all are available on that library, accessible through the PDA website. After we've gotten that great bit of information, we're going to talk about something else that's new at PDA. We now have a strategic forecasting process that's replacing our strategic planning. And to tell us more about that, the chair of the committee that developed that, Dr. Jim Tauberg.
Good evening, everybody, and my pleasure to give you a basic outline as to what we did with strategic forecasting. I should let you know that in the outlines or in the handout section, the basic outline of the strategic forecasting plan or program is actually listed. Certainly there's more to it. So a quick background, I think that's a perfect. Can we go to the next slide, please? So for decades, I think everybody has realized that leaders like us who come on to take part in these kind of programs are really at the heart of the PDA's decisions and our strategies and all our possibilities. So if we're going to lead the PDA into a new era, it really means adapting to a landscape of accelerated and really what you're all finding unpredictable change in dentistry. We all know that yesterday's dentistry is certainly not today's. So we've changed our governance before. We've done that when we went from a House of Delegates to a Board of Trustees and added a Council of Presidents, which is now the Council of Districts. And we had 4-year strategic plans. That is how we had our model determining what we would do, and we would look at it at least every 4 years. Otherwise, we kind of stuck to the plan. However, as you all are aware, the pandemic proved that we needed to be a lot more nimble. Swift action by the ADA and the PDA helped us weather this huge public health crisis, and we kept moving forward when other professions were falling behind. So what did we really learn from this? What we learned is that organizational agility, along with thoughtful and swift decision making, is needed to produce meaningful real-time value to our members, and certainly not have to wait for a crisis to get it done. And this is what is called strategic forecasting, not strategic planning. As many of you are aware, in fact, most of you, the ADA is now in process of implementing strategic forecasting, and it's appropriate now for the PDA to emulate this through a more nimble forecasting program rather than through what we used to do, which was our strategic plan. So to this means we had a strategic forecasting task force. The committee members are in front of you: Dr. Andrew Zimmerman, Dr. M. Nelly Silva, Dr. Sanya Setia, myself, Dr. Jim Mancini, Dr. Lauren Yap, Dr. Jim Boyle, and Ward Blackwell. So we got together starting way back when, actually in August, and as a group, we met multiple times to discuss a proposed PDA strategic forecasting program and help to formulate that so we could all bring it together to the Board of Trustees to see if they felt this was appropriate. I want to give you a really big thank you out there to Ward Blackwell, our awesome executive director who did a lot of the heavy lifting to help organize the proposed program. So similar to the ADA's program, the proposal will consist of, next slide, a strategic forecasting committee. As you can see, it's comprised of certain members. We'll go through that in a moment. Terms and removal. Go to the next slide. And it lists all their functions, their meetings, reports, etc. It is similar to the way the Strategic Forecasting Committee will go at the American Dental Association. How do they get their information? Well, one of the ways is by use of what are called Sigma groups. Can I go to the next slide, please? So Sigma groups will be similar to what the ADA has, is what are called action groups. And they'll be broken into member services, profession, governance, and enterprise. Each one of these groups, the Strategic Forecasting Committee and the Sigma groups, will be comprised of combinations of trustees, Council of District Representatives, at-large members. There will be included, of course, new dentists in every one of these. And of course, where necessary and where appropriate, the PDA president, president-elect, and the executive director. There are rules. Rules have been set through this particular forecasting program. Rules for terms, removal, functions, priorities, budgets, and more importantly, coordination with the already set up standing committees and advisory groups of the PDA, because they are already part of our governance. The Strategic Forecasting Committee, through actions of those Sigma groups and the standing committees and the advisory groups, will put together recommendations. The recommendations will each have fiscal impacts, and they will use various membership surveys and other data gathering along with mission-based reporting to determine the positive or negative effect that will occur putting any new information together to the PDA and to our profession. Let's go another slide, please. Next slide. There we go. So again, and we'll go another slide. Let's go another one. There's terms and removal, another slide. And this is all available for you on the handouts. We're not going through anything individual. Rather, we're giving you a brief overview. And please understand that the Board of Trustees maintains the ultimate authority. However, they will not exercise that authority in any kind of biased or capricious manner to restrict the SFC or the Sigma teams, and for that matter, to the standing committees and advisory groups. And to that, I think one should understand that any of these committees, the Sigma groups, and especially the advisory groups and standing committees, can bring information directly to the Board of Trustees. They do not have to go through the SFC. So it is a similar type of situation and program that the ADA uses, though it is really set up more for the PDA. We even have appropriate information of how chair people will be picked, etc. So I do encourage you to consider downloading the handout. More information will be forthcoming from the PDA, so you'll be able to digest this. But the Board of Trustees has now passed this, and it will begin to be put together in the near future. And with that in mind, thank you so much.
Thank you very much, Dr. Tauberg. I'd like to take my hat off to you for chairing the task force to put this together. That was several very encouraging, thought-provoking kind of meetings that you had to conduct with some people who were new to this kind of thing, but who chipped in a lot of ideas, and your stewardship of that group was spot on. Appreciate that.
Thank you.
And speaking of young, enthusiastic members, there's no group that meets that definition better than our Leadership Academy participants. And the co-chair, who is in charge of making that thing tick, is Dr. Linda Himmelberger, and she's going to give us an update.
Great. Thank you very much. Next slide, please. So this is the class of 23-24 Leadership Academy members. They come from all across the state, and they're all smiling and happy. They were smiling and happy when these pictures are taken, and hopefully they're smiling and happy throughout this whole Leadership Academy process. It's been great fun to get to know one another and to participate in these training modules. So if we could have the next slide, please. So the Leadership Academy had two goals in mind this year at the outset. Certainly, primarily, we wanted to equip the participants with tools that they would need to help them succeed in their leadership roles, regardless of where that was, whether it was their office, organized dentistry, other organizations within the community. And our second goal was to prepare a curriculum, prepare materials that could be used year over year, so we didn't have to keep reinventing the wheel. Now, certainly we're going to be handing out evaluation forms at the end of this Leadership Academy, and things can be tweaked based on the feedback, but we're hoping that we have a really good, solid core curriculum for going forward. So if we could have the next slide, please. So just as an umbrella arching feel for what our members and members of the Leadership Academy and their mentors are doing in background mode is to listen to the Front Street 411, listen to Dental Bites, listen to AdPack podcasts, all of the different kinds of digital resources that are available so that our budding leaders have an opportunity to realize what kinds of leadership materials are out there for them to reference. In addition, each one of the Leadership Academy members was given two resources. One is the ADA Principles of Ethics and Code of Professional Conduct, and they also got a copy of the American Institute of Parliamentarians Parliamentary Procedure, which is now unfortunately out of date. The AIP just issued a new volume in January, but I don't know that the differences are substantive, so they'll still have an opportunity to have this as a reference going forward. We also encourage them to download the PDA Go app, the ADA member app, Dental Dilemmas podcast. If we can go on to the next slide. So the curriculum is as follows. In June, Dr. Friedman did a mentor training for all of those folks who had agreed to be mentors. Each one of our Leadership Academy members has two, and in a couple of cases, they have three mentors, so that they have, our Leadership Academy students have somebody that they are connected to and can ask questions either about materials that were presented on any given webinar, or if things come up just in their day-to-day existence that they feel that they want to have some additional input on. So our first meeting was held in July 21st. That was an in-person meeting at the central office. It was held the same day as a PDA Board of Trustees meeting, which was quite intentional because we wanted our Leadership Academy members to have an opportunity to meet and greet the PDA Board of Trustees. You know, it's one thing to see people's names on a list somewhere. It's a much better opportunity to be able to connect with people. So in the morning, we did, you know, kind of an overview of all things organizational. You know, what's the org chart for the PDA? What's the org chart for the ADA? We briefly went over the Constitution and bylaws, our strategic plan. And we also had an interactive session on what kinds of qualities do leaders have? What kinds of qualities should one be striving for if one wants to be a leader? What kinds of skills or innate talents that you might have are best developed to become a good leader? We then had lunch with the Board of Trustees, as I said, and in the afternoon, we were really fortunate that the directors of each of the departments at the PDA came in and gave just a brief summary of what their department did. So they got to meet, you know, Rebecca Bonita and Rod Pugliese and Mary Donlin, and again, connecting names with faces and just having that relationship building. And I thought it was really interesting that almost everyone who attended that meeting walked out saying, I had no idea the PDA did all that. I had no idea those kinds of programs existed, which is exactly what we wanted to help to convey to them. So if we can go on to the next. September was our dental ethics. Both Dr. Davis and I presented information on the Code of Ethics and went through each one of the different principles, had time for question and answer. As you can see, in preparation, the members were asked to review their ADA code booklet so that they would have some conversant knowledge of what the ADA code was about. So for those of you who know, I'm a past chair of the ADA Council on Ethics, Bylaws, and Judicial Affairs. And I like to tell people that our code is more than 150 years old. It was the first professional code that was adopted by any professional organization, well before medicine, well before nursing, well before any other medical specialty. We had a code. And I also think it's really important for people to remember that rather than the state dental practice acts, rather than the code being developed from the state dental practice acts, state dental practice acts incorporated the ADA code. And if you look at those really carefully, look at them side by side, you will see how much those two documents parallel one another. So I think, again, the members were really impressed to just find out how important our ADA Code of Ethics is. October, we asked people to attend in person our leadership conference. Really spectacular conference. Shout out again to Rich Grossman and Benko. Just a really lot of great information packed into 2 really dynamic days. So the focus for our Leadership Academy folks was actually doing a DISC analysis, which helps to tell you what kind of leadership personality you have. And it also gives you information on other people's leadership personalities and how the 2 of those connect and how you can best work together. We can go on to the next slide. And in November, we continued the discussion from the introduction in October to the DISC analysis. Again, how do you best work together with your different kinds of leadership styles? And next. We skipped December and we went on to January, which was all things parliamentary procedure. You can see what elements we thought we were going to be discussing at our January meeting. But the people who participated in that also learned how to pivot and be flexible, because one of our main presenters was having technical difficulties. And so we had to do a little bit of a dance, but you know, we learned that pivoting sometimes happens. So if we can go on now to the upcoming February, I am really excited for this module. We're going to be talking about wellness and concerned colleagues. And I know that wellness is top of mind for a lot of people. and particularly those in leadership positions, are called on. I'm having trouble, where can I get help? Or they themselves are having trouble, where do I get help? The new dentist committee at the PDA has done an extraordinary job of putting together all kinds of resources to help people navigate a diagnosis related to wellness. So I am really excited to be able to have our budding leaders have access to this information. So we can go on to the next. And in March, all things advocacy. Darlene, you will be, tasked again to talk to us about ADPAC, PADPAC. I also wanted to throw in a little something about the State Board of Dentistry, because there are many of our members who do not understand that the PDA is our organization and the State Board of Dentistry is a licensing state organization. So I just want people to, know the difference between those two. I think you'll remember about 6 weeks ago that the PDA sent out a side-by-side comparison. What's the PDA? What's the State Board of Dentistry? We're going to review that again. And a little bit about maybe getting to know one of our lobbyists. How are regulations promulgated? So I'm excited for that as well. And then April, can we have the graduation at the PDM for our Leadership Academy members when they will receive their certificates for their participation in their hard work and their dedication. If all of this sounds exciting to any of you on this presentation, whether you've been in leadership for a while and feel like maybe you need to hone your skills, or if you're just getting started, watch your inbox for upcoming announcements on how you can register for next year's Leadership Academy. So I have nothing more.
Thank you very much, Dr. Himmelberger. Yeah, I gotta say, I hope this second class is involved when they're past their graduation as the first, because a lot of great talent came out of that first class, and I'm optimistic the same will happen this time, and appreciate all the work you're doing to make that possible. With that, we turn the program over to our PDA president, Dr. Rich Grossman, who has several updates for us. Dr. Grossman.
Hi, everybody. I'll try to make this quick. I certainly want to thank Jim and Linda and Michelle for their presentations. These are the people that grease the wheels and make things go. So hats off to you. First thing, I'll give you a brief summary of our Board of Trustees meeting, which we held on January 19th. At that board meeting, we selected our delegation to the 2024 ADA annual meeting, and we did this. This was a new way of selecting our alternates and delegates, and we used the board plus the Council of District Reps, and it was very fair and nonpartisan, and I think we have a very diverse and engaged delegation. We made progress through our governance task force in trying to develop a very representative change in our quad to tripartite structure. And that is moving forward, and I'm hoping that by April we'll have something more definitive moving forward, and that should fulfill our obligation to the ADA, where we decided to change from our quad to our tripartite. Also, we're also in the last stages of welcoming the Mom and PA board into the PDA Foundation. And in addition, Dr. Boyle and I attended the 3rd District ASDA meeting. I'm kind of throwing this in because I had to leave we got the board meeting over early on Friday in a snowstorm, and I drove to Washington and made it safely. And it was a great meeting. I'm sure Dr. Boyle feels the same way. I have to tell you, we were well represented there with Rupali Kulkarni, Craig McKenzie were presenters. And you know, to go along with wellness, when we were talking about it, I think everyone needs to listen to Dr. Kessler. He gave a talk to the students. He got 2 standing ovations, and I felt it was very moving, and certainly well worth time listening to him. I'm really looking forward to him becoming president of the ADA. We could move on to, I think, our the dental meeting that's going to be our Pennsylvania dental meeting to be held at Mount Airy Lodge. It really is a very nice venue. We think we have a very good agenda. What we're going to have digital dentistry. We're going to have a speaker who's going to talk about geriatric and special needs patients on Friday, and then the next day he'll be talking about local anesthesia. We'll have radiation safety. For those, registration is open. We got a very, very good rate at the hotel for $199. They waived the resort fee. So, you know, bring your spouse, your whatever you want, bring so that there's a beautiful indoor pool and a spa. There's lots of shopping, and we're even thinking of having an axe throwing competition. And on Thursday night, if you get there on Thursday the 18th, Dr. Boyle is sponsoring a dessert reception. I think a lot of people had a great time last year when he did it, and I'm looking forward to that, of course, this year. One other thing that I'd like to go over that is next. I think there's another slide for me, isn't there, Michelle? Okay, so the PDA presidential citation, which recognizes districts and local societies that support PDA's 2023 strategic plan. So societies can achieve one of the 4 recognition levels by completing the goals in the specified number of categories: bronze, achievement in 1 category; silver, achievement in 2 categories; golden, achievement in 3; and platinum, achievement in all 4 categories. So, as you can see on the slide, Philadelphia County Dental Society received platinum, the Dental Society of Chester County and Delaware County, gold; Montgomery Bucks, platinum; York County Dental Society, silver, which is the first time applying and being awarded; and Dental Society of Western Pennsylvania, platinum. And you know, I think this really is a big deal that, you know, these different groups are really trying to benefit. This is a member benefit by their locals. And let me just tell you a few examples of how these societies have gone above and beyond to support their members. Number 1, provided value offerings that members focused. All winners hosted several CE courses. Several of the winners organized and participating in community charitable events. All winners recognized milestone membership years for long-serving members in their newsletters, their websites, or on social media. Increased member engagement. Several winners maintained an active new dentist committee. Several winners utilized PDA's component relations project assistance to send email blasts to its members. Several winners had society members attend PDA new dentist committee programs in person and virtual. Maintained end-of-year membership numbers. All winners utilized PDA's quarterly membership rosters to conduct non-renew contact campaigns. Several winners conducted new member welcome campaigns to make contact with their society's new members. Increased leadership development engagement. Several winning societies' leadership contacted their district PDA trustees to discuss their society's progress. Several winning societies' leadership extended PDA leadership webinars held throughout the year. So I want to thank all those districts and locals volunteers for dedicating their time and talents to provide members with invaluable support on the district level. So as you can see, people in our state are very busy trying to promote PDA, promote dentistry, promote their members, and making their lives more successful. And hats off to all of you. I really think without you, I don't know where dentistry would be in Pennsylvania. So I wanted to make this quick. I know there's a lot more to cover, and look forward to seeing everybody certainly at Mount Airy Lodge in April. Thank you.
Thank you very much, Dr. Grossman. Yeah, that's some pretty cool work done by our district and local societies, and it's good to see them getting that recognition. With that, we're going to change the focus from district and local back up to national, and our ADA trustee, Dr. Jim Boyle, who's got several things to discuss with us tonight.
Thank you, Ward. And congratulations again to the different societies on their award through PDA. We all need to do that in all of the locals. It's certainly helpful as well as the Leadership Academy. I appreciated the presentation by Linda. Just a couple of things before we get into the topic of Medicare. Just this past weekend, some of you may have seen the announcement. Just wanted to formally let everybody know that Mr. Mike Graham, the Vice President of Government Affairs and our congressional political guru, has stepped down, or will be stepping down, and will be taking over as the Executive Director of the American College of Dentists. He will be missed, but he has a very good staff working with him. And I will also share a little side story. Mike is very appreciative of Pennsylvania, especially the other year when the PDA contributed $50,000 to the initiative in Massachusetts. And to show his appreciation, Mike, after a discussion I had with him, really wants the Pennsylvania Dental Association Board of Trustees to meet this summer utilizing one of the two houses that ADA owns in Washington, D.C., and to promote what we're doing with government relations in our nation's capital. So I appreciate Mike acknowledging the efforts of Pennsylvania in doing that for us. The other thing is, and some of you may have heard of this, is our annual sessions committee, or CAM, as it's sometimes been called, has been reorganized by the Board of Trustees. The folks we had from Pennsylvania on that did an outstanding job, but both the Strategic Forecasting Committee at the ADA as well as the board has looked at not the work that CAM had been doing, but what the SmileCon has done the last few years since its inception back in Las Vegas. And it's just reorganized it, and it's asked the volunteers to be a part of a continuing education review committee of the new organized committee of annual meetings. And we will be taking a strong look at this as a true member benefit for the American Dental Association. So on to this particular topic, Medicare. This continues to get attention at the Board of Trustees because of the request by CMS. Can we go to the next slide? So recently, CMS has been asking ADA questions about dentistry and Medicare. And just to cover very quickly, the number of our patients, our population of the age of 65 and over, continues to increase. That should be no surprise to anyone. But those on Medicare now have approached 67 million, 34 are on the traditional Medicare plan, 32 are on the Medicare Advantage plan. But you can see that group as it compares to Medicaid CHIP as well as our commercial dental plans. Next slide, please. And just a quick review, health insurance program of Medicare is administered by the Centers for Medicare and Medicaid Services at CMS. Their headquarters is in Baltimore, Maryland, by the way. It covers people age 65 or older, or those under 65 with certain disabilities, and all ages with end-stage renal disease. Next slide. So it's a single federally funded administered program. Congress appropriates the money. CMS manages the program. Next slide. This is just a breakdown of the cost of Medicare. It's 10% of our federal budget. And one of the things you have to keep in mind is that once the money has been appropriated for Medicare, that is it. There is no more. And that is one of the challenges that we have with Medicare, just from the medical side, with respect to the number of procedures being formed and the amount of money that is available to cover those costs. So what you might find is that the more often, say, a particular procedure is done, say a CT exam, the more CT exams are performed, the payment for that goes down because of the finite amount that is in the Medicare budget. Next slide, please. There's 4 basic parts to Medicare. A covers inpatient hospital services. B covers the outpatient services. Part C allows Medicare beneficiaries to select a private Medicare Advantage plan. Most of you probably have seen in the last couple of years the commercials by Joe Namath advertising for the Medicare Advantage, which allows additional plans under the Medicare umbrella, but it's administered by other plans. And then Part D is what covers the prescription drugs that are utilized by our senior citizens. Next slide, please. So the Medicare Advantage plan is responsible for delivering all of Part A and Part B, but also offers supplemental coverage not available in traditional Medicare. This would include hearing benefits, routine vision, and dental services, as some of you might have known and maybe participate in those. But it's commercially administered by the HMOs and PPOs. Next slide, please. So the reason I just wanted to have a little bit of an overview of Medicare, but this is what is currently going on. A dental benefit in Medicare is being discussed, and legislative activity has to do with eliminating dental infection, restore form and function, and achieve oral health. Payment for dental services under the medical benefit of Medicare, aka also known as medical necessity, is to eliminate dental infections prior to medical procedures to assure optimum outcomes of the medical procedure. Next slide, please. So just Medicare overall for dentistry, it's been estimated it costs $60 billion. The cost of, say, those that just need it for medical procedures such as transplants and all would be in the neighborhood of around $200 million. Now, in the original Social Security Act said no payment may be made under Part A or Part B for any expenses incurred for items or services, and you'll see care, treatment, filling, removal, replacement of teeth or structures directly supporting teeth, except that payment be made under Part A in the case of inpatient hospital services. Next slide, please. And Congress has not amended that dental exclusion since 1980. So policy shift. There's recognition there may be instances where medical service is necessary to diagnose and treat the individual's underlying medical condition may require the performance of certain dental services. We believe that there are instances where dental services are so integral to other medically necessary services that they are not in connection with the care, treatment, filling, removal, or replacement of teeth, but are actually linked to the successful outcome of that medical service. So for example, our orthopedic colleagues, our cardiothoracic colleagues understand that a patient with an active dental infection or abscess is going to have a negative impact on the outcome of their procedure, whether it's joint replacement, valve replacement, or transplant surgery. And so the CMS and those operating it have redefined or reevaluated this aspect of dentistry for those patients. The next slide, please. And just as we're going to the next slide, I will tell you personally here in central Pennsylvania, there's been a few hospitals that have reached out to some of the local oral surgeons to as far as coming in and seeing these patients in their hospital to help with these particular group of patients. So these are hospitals that otherwise don't have a dental department, but they also recognize that these inpatients that are waiting for any of those surgical procedures I discussed do need to get their active oral infections under control. So dental services that were inextricably linked to and substantially related, integral to the clinical success of an otherwise covered medical service, will make payment when a doctor of dental medicine or dental surgery furnishes dental services that are an integral part of the covered primary procedure. Next slide, please. So let's review current ADA policies as it relates to the question of Medicare and dentistry. So this is from 2020, and I'm not going to read the whole thing to you, but let me just cut down to the fourth bullet point, which states, is adequately funded to support an annually reviewed reimbursement rate such that at least 50% of dentists within each geographic area receive their full fee to support access to care. So in 2020, the House of Delegates approved a policy that stated that wherever the treatment is rendered, half of the dentists in that area would receive their full fee. It also allowed for freedom of choice for patients to seek care from any dentist while continuing to receive the full program benefit. Next slide, please. And so at last year's House, that ADA policy was updated. Again, I'll just cut down to the third bullet, which states, is adequately funded to support an annually reviewed reimbursement rate such that 80% of dentists within each geographic area receive their full fee to support access to care. If you go to the last resolving clause, it just states that the ADA emphasized that dental offices are different from medical offices given the equipment and overhead expenses for procedures routinely performed in every dental office, and the current relative value unit system in medicine is not applicable in dentistry. So again, this is the most recent policy from the House of Delegates. I will share with you that the ADA continues to be asked by CMS about moving forward, especially as it relates to these patients that are inpatient in the hospital waiting for significant surgical procedures, but have to have, as those surgical specialties realize, any active oral infections taken care of. Now, some of you might be asking the question, well, why should the ADA even talk to CMS? And that's a valid question. And what you all need to know is, before CMS came to the ADA in dentistry, they first went to the physicians and asked the physicians about dentistry and formulating some type of dental plan within Medicare. And the physicians, the AMA said, no, you need to go talk to the ADA. So that is the reason. So again, the other way of looking at that, what I just explained is, if the ADA were not having conversations with CMS, they would be having them with someone else, and the ADA, or organized dentistry, would not be at the table in terms of these discussions. So I just wanted to let you know the latest and greatest, and the most up-to-date information as it relates to CMS's ongoing discussions with the American Dental Association and dental covered expenses. Please reach out to me, text me, call me, email me your points of view and your concerns, and I'm happy to have a discussion with anybody as we go forward, because it's important that I hear from all of you as it relates to this. But I just want to let you know where the Board of Trustees has been receiving information from CMS. Next slide, please. Oh, another interesting topic. This came up this past week. I will be honest with you all. Up until 2 weeks ago, I never knew what NCOIL stood for, but it's the National Council of Insurance Legislators. And the reason it's important is that NCOIL, which is, it's kind of interesting that you have a national organization of state legislators. These aren't federal, these are state legislators, and Pennsylvania is a participant in NCOIL. Now, the ADA has worked with NCOIL previously on a number of other projects since 2010. These were non-covered services where we saw 41 states enact laws recovered non-covered services. Leasing with opt-in, opt-out since 2021. Also virtual credit cards, where 12 of 24 states became law in 2021 or thereafter. And then prior authorization legislation. 5 of 13 became law in 2021 in the states that are listed. And most recently, on January 16th, there was a discussion regarding dental loss ratio. Now, some of you might remember this was a huge, huge victory for dentistry in Massachusetts a year and a half ago when it was brought on the ballot that the Massachusetts citizens voted by an overwhelming 73% that they wanted to have a dental loss ratio. First time in any state in our union that took place, and PDA contributed money, as did the ADA. The ADA contributed $5.5 million towards the initiative, and PDA, along with 48 other states, contributed money towards Massachusetts initiative. It's just that we still have not received actually anything in a firm law from Massachusetts as to the details. That is still being worked out. In the meantime, if you go to the next slide, a number of states have begun work in formulating their own independent state legislation regarding MLR or DLR bills. And the green states are the ones that began their filing in 2023. And Darlene can speak to this more efficiently than I can, but I will tell you that each state has its own relationship with their legislators that are different from all the other states. Some might be considered extremely well, others might be not as well. But each state has to work out its own relationship with their legislature and getting anything related to dentistry through that legislation, including the DLR, the dental loss ratio. Next slide, please. So as these states in 2023 were going through their process, there were some legislators through NCOIL that started asking, is there some common ground? Is there something that we can use or agree to as maybe a blueprint or a go-by as each of the state goes through the process? So the setting the NLR with NCOIL needed clear definitions, reporting and posting of MLR data, ensures below one standard deviation of mean or outliers, investigate with remediation and state options for those. And outliers after 2 consecutive years must meet minimum DLR, at least the average of the market DLRs. Right now, the market DLR is Maine, which is 83%. But each of the other states will be looking to see where that standard deviation goes from that 83%. Maine, under NCOIL using MLR, only passed in 2020. The mean MLR large group plans is 81%, standard deviation of 11 points. So the threshold for ratio is 70%. If a company, if a dental, let's say Delta Dental drops for 2 years below 70%, the commissioner must impose a medical loss ratio that is at least the mean. And then that means they either have to meet it or be penalized. Next slide, please. So the medical loss ratio resulted then that the ADA supports the concept of a medical loss ratio for dental plans, defined as the proportion of premium revenues that is spent on clinical services. And this is from 2015. And then that the ADA support legislative efforts to require dental benefit plans to file a comprehensive MLR report annually and to establish a specific loss ratio for dental plans in each state. Next slide, please. And as we're switching slides, I will share with you that the dental plans, the biggest thing that bothers them about DLR is not so much the percentage that they have to work under, it's the transparency. They do not like the idea of having to show their records. And that is a huge, huge finding and agreed upon point, not only by the NCOIL, but also by the Dental Plan Association. So they have their own national organization, and that's who NCOIL has been working with. So give you an idea of what has occurred. One of the senior members of NCOIL is a state representative from West Virginia, our neighbor to the southwest. He introduced a bill in January 19th. And once this, it was found out about this blueprint that was worked out with NCOIL, the National Dental Plan Organization, and the ADA, he quickly changed it on February 2nd, introduced this bill, which defines components of numerator denominator within the calculation, requires reporting and posting of MLR data. Huge. The commissioner to calculate the average dental loss ratios. The insurers below one standard deviation of the mean may remediate, including rebate of some of their funds. Outliers after 2 consecutive years must meet minimum DLR, dental loss ratio, of at least the average of market DLRs, and the commissioner in each of those states may identify carriers that increase rates excessively. So these are just talking points and a blueprint for states going forward. So you will probably hear about NCOIL going forward. This is what it was all about. The ADA had to act because there needed to be an agreement from 2 of the 3 members, which were NCOIL and the National Dental Plan Organization, on January 16th. So the ADA showed its nimbleness, stepped in, negotiated, and this is what we have achieved. Next slide, please. All right, so we're going to change gears here now. I want to thank everyone across this state who has been very supportive of the campaign that we are running for ADA President-elect. It is actually humbling, the support and all of your inputs that keep us fired up as we move forward. Again, this has been a 2-year process since October of 23. The vote, just so everyone knows, will take place in October of 2025 in Washington, D.C. at the House of Delegates. Next slide. So again, I thank you. I thank ADA staff for asking me to give an update on our campaign. Just to review, Dr. Gary Davis is the campaign chair. And just to cover some of the specifics, we can only campaign within Pennsylvania up until October of this year at the House of Delegates. Then we can begin our campaign nationally. So we are limited to just gaining support within our state and getting as many help from all of you members and volunteers within the PDA with the campaign. As it relates to social media, we have to be very specific with this. And Dr. Himmelberger has been one of the folks at the ADA that put together the guidelines for this and the campaign guideline instruction at ADA. But please, on social media, do not mention until after this October anything about the candidacy of myself for president-elect. That would be a campaign violation. Certainly posting anything that you choose in terms of what's going on with PDA, ADA, and what we are doing as a state is extremely helpful. But please, no mention of anything about the campaign that we are running until after this fall. We want to continue to promote within our state Pennsylvania's candidate, which is me. And again, thank you to all of you for your support, encouragement, and advice. Any questions, don't hesitate to reach out to myself, Gary Davis, or Ward Blackwell. The next slide, please. And just very quickly, Pennsylvania's candidate, that is truly what this is. This is not about me. This is about our state and our organization. And I'd like to call it, it's the little engine that can. For those of you that don't realize it, the Pennsylvania delegate, or our delegation, or 3rd district, we are the smallest of the 17 districts at the American Dental Association House of Delegates. We are a single state district, but in terms of the number of delegates, we are the smallest of all 17. But I think it's important that those of us in this state, along with me, have the perspective of all of us within the Keystone State. And that perspective, with a successful campaign, will be taken to the top of the American Dental Association leadership. All of us are taking part in this campaign. All of us are represented, and all of us will be listened to as we become, as we run a successful campaign. Some have asked, okay, what else is the benefit to having someone from Pennsylvania since it's been so long? Those of you might not know this, but the president of the American Dental Association makes a number of appointments. and certainly looking at those folks that have been so involved in our leadership and volunteer services in our state will certainly benefit from that. Certain pet projects come along at the ADA level, and those that can benefit our state certainly will be looked at and looked at as in terms of a pilot or using Pennsylvania as a site to begin those. And then again, the accomplishment for all of us who have rolled up our sleeves, given to the tripartite, will benefit in terms of what we have accomplished together. And it's truly an example for our younger members to see what we are capable of doing in Pennsylvania and what our leadership is able to accomplish and how our voice can be heard at the most senior level at the American Dental Association. Our state theme has been, it is time. And the reason again is it's been since 1983 that we have had someone from Pennsylvania represent us at the office of president of the American Dental Association. There have been a total of 3 in the 165-year history of the American Dental Association, and it is time that Pennsylvania again serve in that office. So thank you for your time. I look forward to continue traveling around the state and listening to what all of you have to say with respect to what is important to Pennsylvania as it relates to our profession and the American Dental Association. Thank you very much.
And thank you, Dr. Boyle. It's a lot of really in-depth information there. It's so much to digest, but we appreciate you, walking us through everything like that. And look forward to the next 2 years of watching your campaign, which we all hope will be successful. Folks, we are actually now over our usually planned hour. We did have an update from Dr. Oleski on government relations and AdPAC. Probably going to be okay to postpone that and have her come back with hopefully some more timely news about the movement of some of our PDA legislation when we reconvene in a couple of months. So we're going to wrap it up here. At the moment, I don't think we have any questions for the panel. The only one I had answered earlier from Dr. Davis. So being respectful of everyone's time, I think we're going to just wrap this up early, and we'll have an extended report from Dr. Oleski in April. That is a reminder, by the way, for everybody that, yeah, sorry, poor Michelle's having to fly through those slides. We do these webinars now every other month. So the next one will be in April. If you want to go back and see all the detailed information that came in this one, it's in our video library, as all the recordings are from past webinars. Encourage any of your colleagues who didn't get to see this tonight, if you're talking to them, let them know that's where they can see what they missed. I believe the date of the next one is April 2nd. There it is. 2 weeks before your tax deadline, so hopefully everybody's got everything to their accountant by then and can relax and join us for another informative session. I'd like to thank tonight's panel once again. Thank all of you for joining us, and we'll see you in a couple of months. Till then, stay warm and hope that that groundhog was right. Good night, everybody.